Hey everyone, Dr. Zach Shaw here with the Upper Cervical Spine Center. And we say upper cervical because we work only with the top two bones in the neck. And so we get a lot of questions sometimes about, hey, what can you do for my mid-back, my low back? I have pain here, I have pain there. And we'll talk about that in a little bit. But first, let's talk about something that happens usually in the low back, and that is called a disc bulge, which can turn into a disc herniation or even a disc rupture, which can be very problematic. And so here I have a model of part of the lumbar spine. And these lumbar bones, or these vertebrae right here, in between we have these pads called intervertebral discs, okay? These discs have two parts to them. One is the annular fibers, or the annulus, which surrounds the nucleus, okay? The nucleus is there. It's more of a harder substance. It's kind of like a ball bearing. It allows us to have some space in between there and really be able to move. And the annulus provides some cushion, and it also helps that nucleus to stay in the center of the vertebra, okay? So a disc bulge means that the nucleus starts to move into the annular fibers. It starts to move in a direction we don't want it to go. As a result, this annulus starts to push out, okay? Usually it pushes out in the posterior or backwards, and it puts pressure on the spinal cord right here. And so we start to have pain, we start to have loss of bowel and bladder control, pain down the legs, anything that can happen by putting pressure on this spinal cord. And so usually what conventional medicine will do is they'll take that annulus that's been pushed out of its normal space and they'll kind of cut it out. And person feels good for a little bit, but that nucleus is still not in the correct position. And so the nucleus continues to go out until finally that disc ruptures, or the nucleus pushes completely through that annulus, and now we really have an issue. Now, once that disc is ruptured, we have permanent damage to the spinal cord. Now we have to usually replace the disc or fuse these bones together, and it can be a very detrimental surgery, and unfortunately, we don't see very good results with surgery when we look at the statistics. And so, what can we do as upper cervical chiropractors to not only help with this condition, but prevent it from happening? Well, in upper cervical care, what we look at is the misalignment at the top of the neck. And when this misalignment happens, it forces compensations throughout the rest of the spine, which basically produce weak spots in the spine. These weak spots force abnormal curves in the rest of the spine. And these abnormal curves are what pushes this nucleus into the wrong position, okay? Over time, as this bone stays misaligned, this position gets worse and worse and worse until that disc bulges or it ruptures even, okay? That's why we see amazing results with mid-back pain, low back pain, or what have you, because we can adjust the top of the neck, which is the cause to the misalignment or the imbalance to the rest of the spine. We put the top bone back where it needs to go. This allows the compensations to literally align themselves. The body doesn't need the compensations anymore, allowing the spine to get back to its normal position, allowing this nucleus to also get back to its normal position. Okay? You have never had a drug deficiency, you have never had too many body parts, so it never makes sense to take drugs or cut something out. It all happens at the nervous system, and that's what we look for at the Upper Cervical Spine Center. We check if you have pressure on the nervous system, which could be creating body imbalance or this disc bulge that we see. If you or a loved one suffer from low back pain or mid back pain that could be caused by a disc bulge, you should give us a call at 704-588-5560. We're in the Charlotte, North Carolina area, and we will never ever charge for a consultation to hear you out and see if it may be an upper cervical issue. If you don't live in the Charlotte area, please give us a call anyway, and I promise we will find an upper cervical doctor as close to you as possible. I hope this made sense. I hope you learned a lot, and you have a wonderful day.